Venipuncture is piercing a vein with a needle and collecting blood with a syringe or evacuated tube. It's usually performed using the antecubital fossa, but it can also be performed on other locations if necessary. The inner wrist should not be used because you may damage the underlying structures. If you think you may need to draw from another location, please ask a more experienced phlebotomist for help. Remember to check if the patient has special conditions before you begin the procedure to avoid the risk of bleeding and hematoma formation. So before you begin your venipuncture, it's important to gather all of your equipment. You'll need a tourniquet, some gloves, some tubes, your 2x2 gauze, your alcohol prep, your bandage, your needle holder, and your needle. Be sure that you know where your sharps disposal is. Mine is right there. Keep in mind you'll want to assess the vein to decide what size needle the vein will support. Instruct the patient to sit in a chair and support their arms securely on an armrest or table. Now that you're ready to begin, wash your hands thoroughly and put on your gloves. Palpitation of the site may be performed without gloves as long as the skin is not broken. Confirm the patient's identity and explain the procedure. Then ask the patient if they have ever felt faint, sweaty, or nauseated after having blood drawn. Tie a tourniquet 2 to 4 inches near the area you've chosen. If the tourniquet fails to dilate the vein, have the patient open and close their fist a few times. Clean the site with an alcohol pad. Be careful not to wipe off the antiseptic with alcohol because alcohol cancels the effect of the antiseptic. Wipe in a circular motion, spiraling outward from the site to avoid introducing potentially infectious skin flora into the vessel during the procedure. Allow the skin to dry before you start to draw. Assess the patient's vein to determine the best puncture site. Observe the skin for the vein's blue color or palpate the vein for a firm rebound sensation. Immobilize the vein by pressing just below the venipuncture site with your thumb and drawing the skin taut. Position the needle holder with the needle bevel up and the shaft parallel to the path of the vein and at a 30-degree angle to the arm. Insert the needle into the vein using a gentle glide to penetrate the skin and enter the vein in one smooth motion. Grab the needle holder securely to stabilize it in the vein and push down on the collection tube until the needle punctures the rubber stopper. Blood will flow into the tube automatically. Fill the required tubes by removing one and inserting another. Make sure you follow the proper order of draw. Gently rotate each tube as you remove it to help mix any additive with the sample. Remove the tourniquet as soon as blood flows adequately. If the flow is sluggish, you can leave the tourniquet in place longer, but always remove it before withdrawing the needle. After you withdraw the last sample, place a gauze pad over the puncture site and slowly and gently remove the needle from the vein. Remove the evacuated tube from the needle holder to release the vacuum before withdrawing the needle from the vein. Apply gentle pressure to the puncture site for 2 to 3 minutes or until bleeding stops. Then apply an adhesive bandage. Sometimes a hematoma has developed. If it has, apply pressure until you are sure bleeding has stopped, or about 5 minutes. Then apply warm soaks to the area. Label the specimen and follow proper procedures for labeling and transporting the specimen to the lab. Then remove and discard your gloves and wash your hands. There are several things you should keep in mind when performing venipuncture. Always use safety-engineered blood collection sets to prevent needle sticks. Observe universal precautions at all times. Avoid areas with extensive scarring or healed burns. Avoid collecting blood from edematous areas, atriovenous shunts, fistulas, or vascular grafts. If a patient has had a mastectomy or lymph node dissection, sites of a previous hematoma or vascular injury, specimens should not be obtained from the upper extremity on the same side. If a patient has a large, distended, highly visible vein, Perform venipuncture without a tourniquet. If the patient has a clotting disorder or is receiving anticoagulant therapy, keep pressure on the site for at least 5 minutes. If you're experiencing difficulty getting the blood sample, there are several things you can do. Try repositioning the needle. Ensure the collection tube is completely pushed into the back of the needle in the hub. Use a different tube and try loosening the tourniquet. Probing is not recommended. In most cases, trying another puncture in a site below the first location is advised. Also, a patient should never be stuck more than twice unsuccessfully. Don't be afraid to ask for help if you're having difficulty. Thank you for viewing our instructional video today. If you have any questions regarding what you've learned here, please contact your instructor or Jamie Brock.